The Victorian Inspector General for Emergency Management has handed down his report into the state's emergency ambulance call time performances. Holly Edwards-Smith is live for us in Melbourne. Holly, what are the recommendations?
Good morning, good afternoon, Gab, rather. Well, there have been a number of recommendations made for both the emergency ambulance call system here in Victoria as well as future pandemic management. Two reports have been handed down by the IGM today, Tony Pearce, and there have been 8 recommendations made in relation to Victoria's ambulance call answering system. I'll go through some of his findings first and then a number of those recommendations. So finding 4, for example, shows that the Emergency Service Telecommunications Authority here in Victoria did meet primary ambulance emergency call speeds, did not meet any ambulance emergency call answer speed benchmarks between December 2020 to June 2022. But they did say before the pandemic they were meeting those benchmarks, which is to answer 90% of emergency calls within 5 seconds. Prior to the pandemic, they were doing that on a very consistent basis. So a number of the recommendations, the first being that the Inspector General for Emergency Management recommends that the Victorian Government advocate for the Australian Government to help changes to 000 answering call policies. The 7th recommendation is asking for consultation with other emergency service organisations and Emergency Management Victoria to conduct research into optimal shift patterns and rostering, because a large number of the delays are due to a lack of resourcing, or have been due to a lack of resourcing. This is something that today the Emergency Services Minister and Attorney General for Victoria, Jacqueline Symes, acknowledged that there had been lacking, but she says the Victorian Government have been doing everything they can to improve these outcomes.
Planning was done, but forecasts were unforeseen what was going to happen. The fact that so many of the workforce would not be available, whether they were sick themselves or caring for someone at home, had disastrous impacts on an organisation that was committed to helping the very people in the community that were impacted by the same pandemics.
Both IGM and Esther acknowledged that between the 1st of July 2021 and the 31st of May 2022, there were 40 occurrences in which people were making calls to emergency service hotlines and they weren't being answered. Those delay times have led, or at least are associated with, the deaths of 33 individuals. Now today, the IGM did say it wasn't his job to make the conclusion whether or not those individuals did pass away because of those delays. That's something that should be left to the coroner, but he did say that Esther is already putting in a number of protocols that have been announced in this review, and they'll continue to do so.
There's nothing that we're not acting in this review. There's many things we've already actioned in the Ashton review. We'll keep rolling forward. It's an important emergency service, and we'll keep building it to get it to where I think it needs to be, and most importantly where the people who work in it think it needs to be, and more importantly for those members of the community that expect it to be. And we're getting there now.
The Victorian Government today have said that they, in principle, accept all 8 recommendations and have been and will continue to work to improve them and implement them to make sure that Esther is acting within its call service time. For August 2022, it is the first time since October last year that benchmark of 90% of calls within 5 seconds has been met.
Holly Edwards-Smith, thanks so much.